obviously some significant challenges when it comes to working or using the One Health approach. Obviously the main one, or one of the main ones, is that you have a lot of different stakeholders, you have a lot of different sectors working together, and these sectors, if it's agriculture, if it's animal health, human health, Ministry of Health, or environment, these are very specialized sectors, and often they may not be used to working together. They may feel uncomfortable working together. I think that's normal. It's a new thing sometimes. So actually getting people to work together isn't always easy, and there has to be strong leadership to help guide that process, and there has to be willingness from the stakeholders to adopt that One Health approach. And it'll come back, I think, to a key theme of what we're trying to get at here is there has to be a good explanation of the value behind that. I just think we might have a question, just a technical question about the PowerPoint. Hopefully you can all see the PowerPoint. If you can't see it, just let us know in the chat, but hopefully you can all see the PowerPoint now. And so just to carry on back with the content, another big issue in One Health, which is often, I think, in a lot of One Health discussion, it's neglected, it's just sort of, I think, forgotten about, is that the lack of sufficient resources, especially in agriculture, the animal and the environmental sector. So it's one thing to say that, oh, we need to have the One Health approach, it's fantastic, it can help with these problems, but you need to, or there has to be recognition that a lot of these sectors, and the health sector also faces, I'm sure, lots of resource constraints, but the other sectors need to have the basic resources, the staff, the operational equipment, for them to genuinely contribute to One Health, not just through the sector, but also at different levels. So not just at the national level, but at the provincial level. And unfortunately, that sometimes I think we in One Health are guilty of just forgetting that, you know, if the environment sector, or if there are not enough vets or extension to, I guess, deal with what's a very complicated problem, there are going to be longer time frames, and there are going to be different metrics for success. There are going to be different ways of measuring things. So the project design in One Health needs a lot of good quality thinking. Like, it's not always easy to do that. You can, you know, there's an example, obviously you can easily measure this many animals, children or animals are vaccinated. Environmental measures and indicators can take years. They can take, obviously, decades. And there's a big, I guess, attention is a good way to describe it, in that One Health is, you know, it does take a systems view. It does take a broad view of the main drivers for health problems, and it can be guilty, or the tension is that it still has to be practical. And I don't know if any of you have heard this saying, like my boss, I used to live in Vietnam, and I had a boss there who was very clever, but he said, you know, you can't boil the ocean. So it's trying to make sure that you, somewhere in that project design, there also has to be a recognition that if it's donor timeframes, if it's 3 years, there has to be a practical, pragmatic approach, which is not always easy, and it's I think a big tension in One Health. And there's lots of other challenges, but I'm just giving a broad overview of some of the main ones. One Health is also something that, when you look at it in application, it's an upstream effort. So the work has to be chosen rather than demanded of you. So if you had the example there where a health clinic has to or has patients come in and there's a huge demand. So actually saying that we need to have some resources, and it's very hard because in a lot of settings there's only limited resources. So you are trying to say that, okay, we don't even have enough resources to meet this demand that is facing us at the moment, but in the long term, it's actually beneficial to try and reduce the disease before it even happens. But actually being able to get resources for that is very difficult, for a lot of issues, political decision makers and politicians usually, because of the way their politics works, may not have a 10, 15-year view. And some of these upstream problems require that leadership and that trust in the long-term benefits. So what a lot of this comes down to, and hopefully not just with today's workshop or today's introduction, but in the future collaborations we have on this, is the advocacy is really important. So advocacy with that strong economic component, because a lot of this challenges of One Health in terms of getting ministries, institutions to work together, it needs high-level political support and it needs sufficient resources. So the advocacy and the articulation of the benefits is very important. And that's obviously something that we are trying to, that's one of the big purposes of this course, is to try and improve that and try and get that type of thinking across the various minds we have today. So those are just some of the challenges. And just, again, to give more examples of what One Health may look like, when we say, let's work together, what does that mean? If you just say that, obviously you can have different meanings, but it's sometimes helpful to think about, okay, are we going to work together by improving communication? Is it going to be coordination? Is it collaboration? Or is it integration? So each of these each of these methods or ways of working together, we're not saying that one is the best way, this is the worst way. It's just giving an example of different types of ways that people can work together. And again, they're not going to be mutually exclusive, and we'll unpack each one a little bit more detail. So again, it can help when you're thinking about a One Health approach to think which types or how do we work together? Do we communicate? Do we integrate? And so on. So when we think about communication, this is an example. This is an example from Bolivia. So when we had deaths that was in this type of monkey, howler monkeys, the deaths were obviously in the monkeys. They were identified as yellow fever, and then it wasn't any more complicated or fancy than that information being well communicated. So it was communicated from one sector, being the wildlife, environmental sector, to the health sector, to universities, to the government. And because that communication was there, it allowed prevention strategies, human vaccination and awareness campaigns, and obviously a positive outcome where no humans were infected. So that's an example of communication. Here's an example of collaboration. And this is actually an example, and some of you may be very familiar with this. Is the Lawa project that was actually in Thailand. And I know it's a complicated diagram, but in a nutshell, this was a One Health or an eco health approach to tackling a disease. And without going into the intricacies of disease, what you can see around this diagram is in the green boxes is some of the actions, and then beside them is who was involved with that. So you can see that at the top there, it was things like preparation of the food, inspection of the fish. So you had involvement from local restaurant owner, you had involvement from biologists. Then you actually have some human health actions where you're looking at targeted praziquantel treatment, you're looking at education, you're even including things like WASH, that's including waste treatment. And the actors, the participants there are obviously doctors, the health volunteers, the local school. And because this disease also spreads around in animals, you then also had involvement of the vet or the animal health sector, where animals were treated, surveillance was done in animals. And finally, you also had involvement from ecologists, biologists, looking at actual control of this parasite, which lives and actually goes through a key part of its life cycle in snails. So they needed, or that sector also needed to be involved to look at how the environment needed to be modified. And you can see that, of course, that is a complicated and difficult project design, but the results were very successful because they adopted the One Health approach and worked with a lot of different sectors. You're getting a very good outcomes for the communities that were dealing with this disease. And again, just to highlight, so that's an example where it's not just communication, but it's actual collaboration and coordination of activities. Another example, and this is actual integration, and this comes from Canada. So AMR is a very big problem, and the Canadian system actually integrates all the surveillance on antimicrobial use. So who's using which antibiotics, how, in what capacity and how they're using it, but also antimicrobial resistance. So you can imagine that because AMR is a problem that's not just going to happen in the human sector or the animal health sector or the environmental sector, having all these different sources of data brought together, it allows decision makers, it allows us, broadly speaking, to more quickly identify where there might be issues. It allows better understanding of, okay, if this intervention was tried, this was the results. So it's, again, very important, and this is very integrated because all of that stuff is coming into one. So just before we think, okay, if we do want to think about what types of, is it collaboration, is it communication, is it coordination or integration, we do have to think that not every One Health activity can be fully integrated. So for example, if we have highly specialized knowledge, so for example, if it's about treatment of animals, veterinary treatment of animals and humans, that can't necessarily, or that just can't be integrated. You can argue it's a very specific thing. You can't really ask a vet to vaccinate an animal, a human, and vice versa, as an example. And I just have a photo that I took trying to vaccinate a cow. It's sometimes tricky, but that just is something to think about. So integration is not always going to be the answer. There's also timing consideration. So if activities have specific time impacts, and then it's very important that those benefits will, or if there are those time impacts, then coordination will be very important. And that's probably, again, if we go back to that last example where you had the disease that moved from snails to fish to people, that's a good example where coordination of that activity is very important, because if you just said, okay, this year we're just going to target the, disease control in animals, and it's meanwhile spreading in all the other populations, it's spreading in the snails, it's spreading in the fish, it's spreading in the humans, then you're not going to have that chance of really stopping or getting the reduction in the disease that you would if you coordinated the actions and targeted all the reservoirs. Externalities are also important. So if the externalities of the activities or of the two of the activities of both parties affect each other, then the benefits are obviously greater, and at least to the point of collaboration. So that's a very important thing, and we'll probably look at externalities a little bit more later, because that's quite an important economic concept that I think Justin will cover. And finally, the economies of scope and joint production. So if there is significant scope for economies of scope and joint production, then obviously the benefit from integration will be quite high. And this is an example, the photo speaks to it. It's a newly formed, it used to be called something else, but it's now called Australian Centre for Disease Preparedness, where it's obviously one, very expensive, large laboratory, but it can do testing and it can obviously service both human and animal needs. So if you think of the capital, if you think of the running costs, it's more efficient that those or all that is done in one building under one sort of running cost. That's not always going to be possible for everything, but again, it's about where there is the potential for economies of scope and joint production. Definitely there's a case for integration. And that just probably sums it up in a little bit of a diagram. So you have, at the top, you have the 4 different ways of working together. And I think we're not saying that a One Health activity has to be one of those. It can change, it can be a little bit of both, but generally speaking, from communication to coordination, collaboration and integration, it gets more complicated. So by the time you actually have a joint laboratory that's testing human and animal and so on, that's going to be integrated, and that's something that is not always going to be easy to set up. That's going to require a lot of planning and effort. And just think about the considerations. So obviously, as you go from communication to integration, if there's lots of specialist knowledge, that's going to be difficult. So it's maybe better to communicate. And then you can see, obviously, for the rest, the timing, externalities, and so on, you can maybe get the maximum benefit from or you can get a lot of benefit from coordination and collaboration. But if there's economies of scope and joint production, then you really ideally want to try and integrate to get the maximum benefit. And I'll just leave with this because we want to come back to this, and this is a question that does come up often, and there are some good answers for it. For every One Health talk, it's why should we do, we have to think of always, if you're trying to practice One Health, if you're trying to implement some sort of One Health project, what's the point? What's the value of this combined effort? Is it saving time? Is it saving money? Is it getting better results? It could be something else that I haven't put up there. And again, to reinforce, this is where economic thinking and really good quality economic thinking and analysis is critical, because I think that can help us explain why we need to make this effort in One Health. Because yes, as we said at the start, there are challenges, and it does require, in some cases, it requires people to do something differently than they've done before, and that's not always easy. So thinking about how to show value is very important. And yeah, that's again the end of that. So if you have any questions, we maybe have a little bit of time if you have a few questions. Otherwise, we can always answer them at the end as well, or you can ask them in the breakout rooms, no problem.